Hi everyone, welcome to week number 5. Can you believe it's already week number 5? We're halfway through this quarter. Time flies here, I guess, at Rasmussen. Anyway, this week what we are dealing with is chapter 35, which is dealing a lot with your vital signs. So what we're going to do is I'm going to kind of go through each one of them. I'm going to give you some helpful tips and tricks about each vital sign, and then we'll meet in class and we'll do a lot of these vital signs. So it's really important that you understand, as a medical assistant, vital signs are your main responsibility. You are taking that snapshot for the provider, making sure that you can tell them how that patient's body is functioning. So it's really important that you know how to do these properly and get lots of practice with them. So the vital signs that you're responsible for taking are height and weight, temperature, pulse, respirations, and blood pressure. So let's talk about each one of these individually. So weight is one of those one of those vital signs that should be taken at every single visit, no exceptions. You really should make sure that the patient removes their shoes and takes off any heavy clothing, jackets or sweaters prior to actually taking their weight. Because weight is one of those things that can be a big indicator for general health of a patient. It's also important that patients remove their shoes because those add unnecessary weight. Now, if a patient really wants to weigh without clothing on, that's perfectly fine. Give them a gown, but make sure that you document that. Height's the next vital sign, and height and weight generally go together because you want patients to have their shoes removed for their height as well, because that adds unnecessary height for them. Height can really only be done about once a year, generally when you do your physical exams with your patients. Unless, of course, you have a patient who is elderly or who is a woman, because women and elderly patients generally tend to lose calcium out of their bones, causing them to get osteoporosis, which makes them shrink. So it's important that we take their height vital sign more frequently than we do other patients. You want to make sure that the patient's feet are touching the wall, so their heels are backed up till they touch the wall, their buttocks touches the wall, and their back. So they're standing perfectly upright, perfectly straight. And then that L-shaped beam should be placed on top of their head, not on top of their hair. Women are very, very bad about putting their hair on top of their head. So when you're taking a patient's height, make sure it's on top of their head, not their hair. Temperature's next, and temperature is really important because it regulates your body to give it the appropriate amount of heat. Normal body temperature is 98.6 degrees, and we can do temperature in either Fahrenheit or Celsius. And your book's really good about actually describing how to calculate those, so take a look at that. You should be reading your book anyway, even though I do these wonderful little videos for you. There are 5 places that you can really take a temperature: oral, rectal, auxiliary, aoral, and temporal. So I'm going to make you guys have to know the difference between all 5 of those, and we'll talk about them in class this week. Pulse is next, and pulse is really the number of beats per minute. During your cardiac cycle, the pulse is when your blood is pumped out of your left ventricle, and it's characterized by 3 things, okay? It's characterized by rate, volume, and rhythm. Rate is the number of beats per minute, volume is the strength of those beats, and rhythm is how equal or unequal your pulse rate is. And just like when you take a temperature, there's different places that you can take a pulse. The most common is going to be your radial, but then you can also use the brachial, carotid, temporal, femoral, popliteal, dorsalis pedis, posterior tibial, and apical arteries to take a pulse. I'm putting it on you, again, to know all those because I'm going to ask you in class. Respirations come next, and really that's the act of breathing, okay? 1 inhalation to an exhalation. So, for example, that's 1 breath, okay? Your patient should not know that you're taking their respirations because then they alter how they breathe. So that being said, you want to take your respirations when you do your pulse rate. First 30 seconds is a pulse, second 30 seconds is a respiration, and then you multiply those numbers by 2. Average respirations for a patient are anywhere between 14 to 20 Children, however, are higher. They are generally 30 to 50 breaths per minute. Alright, and the last one we have today is the blood pressure. So blood pressure really should be taken as the last vital sign. Reason being, you want patients to be able to come in and relax before you take their blood pressure. Blood pressure is the most important vital sign to aid and help diagnosing and treating a patient. That's why it's important that we have a very accurate one. This should also be done at every visit, just like the weight, okay? And blood pressure is really the amount of force exerted on the artery walls while the heart is pumping. Okay. Average blood pressure is around 120 to 80, but there are several factors that affect blood pressure and can change it. The two major ones are age and gender. Age, because at birth, where we have our lowest blood pressure, and as we grow older, that actually increases. And for gender, women are generally the ones who have lower blood pressures than men, so it's important to keep that in mind when you're taking blood pressures on patients. Alright, so this week, because we are doing a lot of vital signs, it's really important that you all bring your blood pressure cuffs, your stethoscopes, and a watch, okay? That watch needs to have a second hand, or if you have a digital one, it needs to have the seconds put in on it, okay? You have one discussion post, which is looking at abnormal vital signs. Please make sure you're doing your initial posts on Tuesday. That's the requirement. That's what's on the calendar. So please make sure you're doing that on Tuesday, and your 2 responses are due on Saturday. You also have one written assignment this week, which is talking about abnormal vital signs and diseases. So what you want to do is you want to pick one disease that you find interesting and look at the vital signs that can be indicators for that disease. This should only be about 1 to 2 pages in length. Again, nothing crazy. And that's going to be due Sunday at midnight. Also this week you will have your midterm exams. So please make sure that you come to class on Wednesday, because we will be doing a review just like we did last week in week 4. And your exam is going to be due then on Sunday at midnight. If you have any questions or you don't understand something, bring it to class. We're going to spend a lot of time doing hands-on vital signs so I can work with you all individually, okay? Alright guys, I will see you on Wednesday. Have a wonderful week. Bye.